Patients seeking X-ray services at Soroti Regional Referral Hospital have been relieved of the burden of high costs and long travel distances following the procurement of a new X-ray machine worth 600 million shillings by the Ministry of Teso Affairs. For the past 7 years, patients were forced to either travel long distances to Mbale Regional Referral Hospital or incur high expenses at private health facilities after the hospital's previous X-ray machine broke down.
Patients from Teso, Karamoja and Lango sub-region seeking for X-ray services at Soroti Regional Referral Hospital will no longer travel to Mbale Regional Referral Hospital or private health facilities following the procurement of a new X-ray machine by the Ministry of Teso Affairs.
That is why you saw I was putting a lot of pressure, because we were losing that money. And every time we lost it, that meant the following year we had to decide our budget minus 600 million. And for Ministry of Teso Affairs, I can assure you, 600 million is a lot of money. But I was determined that this X-ray machine must come here.
Now we have the X-ray machine. It has taken long. We came here in May 2022, and then we handed you over a dummy check. We expected this machine to have been bought by 2022. But because of your internal politics in the hospital, it is what dragged this process.
The newly digitalized machine, capable of handling up to 30 patients daily, was acquired to replace the previous one, which had been out of service for 7 years.
We work on you, we don't have to use the darkroom to process images. When we work on the patient, we process immediately and the patient goes away with their film. So this one makes the waiting time short. The patient doesn't have to delay. Also, as the workers, it eases our work.
During the handover, Jonathan Ebwalo, the Member of Parliament for Soroti West in Soroti City, cautioned the hospital leadership against imposing charges on patients seeking for X-ray services.
But I have a problem with the CT scan. Last week, one of my persons was brought here. He didn't have the money. They told him the machine was broken down. I told him, I'm going to send you money. When I sent him money, they scanned him. 200,000. We don't need to do that.
The NRM government is the only government in the whole of Africa now where primary health care is given free of charge. It's the only. In every other country, you now pay for even primary health care.